Hello and welcome back to PharmaApex Tutorial. Today we are going to discuss next chapter of Pharmaceutics, that is Posology, which is the last part of Unit 1, and in this video we will cover the definition of Posology, factors affecting Posology, pediatric dose calculation based on age, body weight and body surface area. So let's begin. So what is posology? So the definition of posology is it is the branch of medical science that deals with the determination of the dosages of medicines and drugs. It involves the study of how much of a particular drug should be administered to a patient, considering factors such as age, weight and severity of the condition being treated. So what is posology? Basically, posology is a part of medical science that focuses on figuring out the right amount of medicines to give to a patient. Here they have to consider some of the factors such as the patient's age, weight and how serious the condition is to decide the correct dosage of the medicine or a drug. Now we'll discuss the factors that can affect posology. The posology can be affected by many factors such as age, weight, genetic factors, many more. We'll discuss them one by one. First factor is age. Dosage requirements can vary significantly between infants, children, adults and the elderly. That is, the dosage given to infants and children are smaller compared to those for adults. Next is weight. Heavier individuals may require higher dosages while lighter individuals may need lower dosages. Next is gender. Hormonal differences can affect drug metabolism and efficacy of the medicines. Next is health status. Conditions such as liver or kidney diseases can affect the drug metabolism and excretion of the drug. For example, let's see metformin. Metformin, which is the commonly used medicine for type 2 diabetic patients, that can be influenced by the health status factors such as kidney functions. Patients with impaired kidney function may require adjustment in metformin dosage to prevent accumulation of the drug and potential side effects. Regular monitoring of kidney function is essential to ensure safe and effective use of metformin in the diabetic patients. Next factor is genetic factor. Genetic variation can influence drug metabolism and responses. Here we can see the example that is metformin. Metformin such as a variation in CYP2D6 enzyme activity can influence how the individuals metabolize morphin, which can impact the effectiveness and side effects of the drug. Next is drug interaction. Concurrent use of other medications can affect the action of the drug. For example, warfarin. Warfarin is a common example used to thinning of the blood. If a patient starts taking antibiotics like amoxicillin, it can increase the effect of warfarin that will lead to higher risk of bleeding. So the warfarin dose may need to be adjusted to maintain safe and effective blood thinning. Next factor is tolerance. Repeated use of a drug can lead to tolerance, requiring higher doses to achieve the same factor. For example, morphine. Morphine effectiveness can vary with a different route of administration, such as oral morphine might require a higher dose compared to intravenous morphine to achieve the same pain relief. This happens because intravenous administrations delivers the drug directly into the bloodstream and making it more potent than other dosage forms. Next is route of administration. The method by which the drug is administered, for example oral route, intravenous route, etc., can impact its dosage and efficacy. For example, let's see insulin. Insulin's effectiveness can vary with the different route of administrations. For example, subcutaneous insulin injections might require higher dosages compared to intravenous insulins to achieve the same blood sugar control. This is because intravenous administration delivers the insulin directly into the bloodstream, resulting in quicker and more potent effect. Next is diet and lifestyle. Factors such as diet, alcohol consumption, and smoking can influence the drug metabolism. For example, let's see warfarin. Warfarin's effectiveness can be influenced by diet and lifestyle. For example, eating foods high in vitamin K like spinach can reduce the warfarin effectiveness, requiring doses adjustments. Similarly, lifestyle factors such as alcohol consumptions can also affect how the drug works, necessitating carefully monitoring and dose changing. Next factor is environmental factor. Temperature and altitude can affect how a drug is absorbed and metabolized. For example, let's see cetirizine. During high pollen seasons, individuals may experience more severe allergy symptoms and might need to increase their cetirizine dosage, and in low pollen environments, a lower dose might be sufficient to control the symptoms. Next part is calculations based on age. So first is Young's rule. This formula is used to calculate the dose for child who are under 12 years. So the formula is age upon age plus 12 into adult dose is equals to dose of child. So let's see the example. The question is, if the adult dose is 500 mg and the age of child is 5 years, what will be the dose for child according to Young's rule? So let's see 5. So according to the formula, we will use this information and put it into the formula. So age is equals to 5. So here the 5 and age plus 12, so 5 plus 12 into the adult dose. So here we'll take 500 mg as an adult dose, and after calculation we'll get the answer, that is 147 mg. So here therefore the dose of the child is 147 mg. Next is Dilling's rule. This formula is used when the children's age is between 4 to 20 years. So pediatric dose is equals to age in years upon 20 into adult dose. This is the formula for Dilling's rule. So here we'll see the example. So the question is, if the adult dose is 50 mg and the age of child is 5 years, what will be the dose for child according to Dilling's rule? So let's put this information into the formula. So pediatric dose is equals to age in years. So here age is given 5 years. So we'll put the 5 years, and 20 is the constant. So this is 20 into adult's dose. Here we have given that the adult dose is 50 mg. So here we'll put 50, and after calculations we'll get our answer, that is 12.5 mg. So therefore dose for the child is 12.5 mg. Next is Cowling's rule. This formula is used for the children age 2 or more. So the formula is pediatric dose is equals to age at next birthday in years is upon 24 into adult dose. So let's see example so that you understand it properly. If the adult dose is 60 mg and the age of child is 2 years, what will be the dose for child according to Cowling's rule? So pediatric dose is equals to 2 plus 1. 1, that is the next birthday. So here we have taken 1. So upon 24 into adult dose, that is here it is given that it is 60. So we have taken it 60. So therefore the dose for the child after calculation will be 7.5 mg. Next is Fred's rule. This formula is used for the children aged younger than 1 year or age of child in months. So the formula here is pediatric dose is equals to age at months and upon 150 into adult dose. So let's calculate with an example. Calculate the child dose for 1-year-old baby if the adult dose is 200 mg. So here they have told us that age at months. So while calculating, we'll see that 12 is equals to 1 year. So here they have given that 1-year-old baby. So therefore we have taken it 12 in months upon 150 into adult dose. So here it is given that adult dose is 200 mg. So here we'll take 200 mg and therefore the dose for the child will be 16 mg. Next, we'll discuss calculations based on body weight. So first is Clark's formula will be used here. Based on the child weight in kg or pound, there are two formulas. First, pediatric dose for when the child's weight is given in kg. So the first formula is pediatric dose is equals to child weight in kg upon 70 into adult dose. Next is pediatric dose is equals to child weight in pound upon 150 into adult dose. Therefore, when the child's weight is given in kg, we have to use the first formula, and when the child's dose is given into the pounds, we have to use the second formula. Let's understand Clark's formula with the help of example. An adult dose of drug is 200 mg in 3 times in a day. What will be the dose for child having weight of 40 kgs and 75 IBs? That is, pediatric dose when the weight of the child is given in kg. So according to the formula, the age of child in kg, that is 40 kg upon 70 into the adult dose, that is 200 mg is the adult dose. So we'll get the answer, that is 114.2 mg. Next, when the weight of the child is given into pounds, we'll use the second formula, that is pediatric dose in pounds is equals to 75, that is weight given into the pounds, upon 150 into the adult dose, that is 200 mg. So the answer, the dose will be to 100 mg. Now we'll see the calculations based on body surface area. So the formula is pediatric dose is equals to body surface area of child in meter square whole divided by 1.73 meter square into adult dose. So let's understand it with the help of example. So an adult dose of drug is 200 mg in 3 times in a day. What will be the dose of child having surface area of 0.8 square meter? So with the help of formula, we'll calculate this problem. Pediatric dose is equals to 0.8, that is body surface area of child in meter square whole divided by 1.73 meter square. So here we have cancelled the meter square and meter square into 200, that is the adult dose of drug that is given into the question. So after calculation, we'll get the dose of child, that is 92.4 mg. So here we are done with the chapter Posology. Thank you so much for watching the video. If you enjoyed this, don't forget to like, subscribe for more content. In the next video, we will start the next unit of the subject. Till then, keep watching and keep learning.